health information technology, disease registries, e-prescribing, electronic medical records, electronic health records, complete EHRs, modular EHRs. Feeling a bit lost? Do not worry. We are here to help you find your way. Over the next 30 minutes or so, we'll answer your questions about practical strategies for selecting an EHR. Hi, my name is Beth Heft. I'm a clinical applications coordinator for Michigan's Regional Extension Center. For the past year and a half, I have been helping physician offices select and transition onto various health technology products. The Regional Extension Center program is completely vendor neutral, and therefore I am as well. I do not work for any technology company, nor do I represent their products. This presentation was designed based on feedback we have received in assisting physician practices. And please note, it was designed to be watched in its entirety, and skipping around, it may not provide you with all the information required to successfully select an electronic health record product. Before beginning, we would like to remind you that we have provided materials to accompany this presentation. Be sure that you have printed them out before you proceed any further, as we will be referencing them throughout the presentation. So if you have not done that, go ahead and pause, print those out, and come back. The goal of the vendor selection process is to evaluate the marketplace and narrow down the field of vendors that you would like to study more in depth. The goals of this workshop today are to understand the processes involved with this selection phase. You want to understand what the functionalities you want to look for in a product. You want to make sure that you know how to select a product. So the objectives here today are to identify the type of health information technology that's available to you, to identify the methods to conduct successful due diligence, and to be able to describe the strategies for choosing the most appropriate technology for your office. So the question most people have is, where do I begin? Before beginning your selection process, you have 3 things that you must do. The first and most important step, create a team that will help you through this process. No person can do this by themselves. It takes a team. Team development is critical for any stage or phase of EHR selection, planning, or implementation. All levels of support staff should be involved in the selection process. The more involvement from the office, the less pushback that you ought to get. And there are 4 stages that you can expect to go through with your staff. Things start out fine as you form your team. Everybody's excited, or maybe not so excited to be involved. And then the differing opinions come out, and the storming begins. With the right direction and focus, however, the team's going to begin to settle in, and they're going to begin to feel a little bit more normal. And before long, everybody's performing within the team and progressing with the project. The selection process involves commitment, and everybody's least favorite thing, change. Getting everyone in the same boat with the impending changes will lead to a smoother transition and hopefully fewer obstacles. You want to ensure that you have the appropriate team for selection and utilize them to ease the transition through the process. In a small office, you want to consider giving everyone a role. Remember that people come in all shapes and sizes with different viewpoints, countless opinions, varying communication skills, and different thinking styles. And believe it or not, this is actually a good thing. You need different perspectives to make sure that you're selecting the right product for your office. The next important step to take when beginning the EHR selection process is develop SMART goals. Your goals should be specific. They should not be too general, but they should be concentrated to one area of focus. They need to be measurable. Creating metrics to your goals would be like assigning a percentage or a specific number. The metrics allow you to measure your progress towards achieving your goals. Your goals also need to be attainable. Ensure the task is within reach and can be accomplished given your practice resources. There's nothing more, unmotivating than trying to achieve something that isn't actually attainable. You also want to make sure that your goal is relevant. Do not pick a goal that doesn't relate to your patient population. For example, you wouldn't want to create a goal to increase immunization tracking rates by 10% if you rarely give immunizations. It wouldn't have enough value for your office. And lastly, you want to create a deadline. Without a deadline, people just find it way too easy to put things off. Now, while developing your SMART goals, you want to think of the functionalities that you would want from your electronic health record. For instance, if you want to obtain or retain patient-centered medical home designation, it's essential that you have access to patient data and quality reports. If you would like to improve patient safety as one of your goals, then you should consider applying the SMART rule to your goal. Is it specific, measurable, attainable, relevant, and timely? Maybe reaching meaningful use is one of your goals. Then you should definitely be asking yourself these questions. Does the system have the functionality needed to achieve this? Can it capture clinical data in reportable fields and monitor provable quality measures? Does it enable you to proactively ensure prevention health compliance? These are very key things that you're going to want to think about when developing your goals. The last step before actually beginning selecting a product is mapping your workflow processes. It's important to map out your workflow process because it creates a visual diagram of the processes within the daily work operations and tasks. It establishes a common language which standardizes the office processes among all the staff members. This way no one's off doing the same thing in task in multiple different ways. So mapping your processes will also highlight connections among the activities, information, and flow. And it provides a blueprint for your daily functions and operations for easier decision making when it pertains to workflow changes. This is another way to remind you to refine your processes. Often you don't think about it until you have it laid out in front of you. So when it comes to tracking anything within your EHR, it's imperative that everyone is documenting the same way every time. You want to remember, if you're putting garbage in, you are going to get garbage out in your reports. You have to fix all the broken processes before you transfer the broken ones into your electronic workflows. When you map your processes, staff have an opportunity to give their input regarding how they currently perform the task, and then it opens up the dialogue for how it should be done or perhaps maybe how it needs to be done. Choosing an electronic health record requires thoughtful consideration in order to select a product that's right for your office. Health information technologies such as electronic medical records and electronic health record systems exist to facilitate and document the efficient delivery of safe quality care. You want to keep in mind that an electronic health record, it's just a tool for your practice to accomplish your clerical and clinical tasks. It provides all patient information at your fingertips and keeps it all organized. The beginning of the selection process involves having an idea of what your budget is. Then next, you want to discuss with your team a realistic timeline of when you want to begin seeing demonstrations of products, when you would like to have the product picked out, installed, training completed, and implementation of the product for your day-to-day operations. You want to research the products that are of interest to you or that you've heard of from your colleagues. This process should include determining the health IT functionalities that are a must for your office. Do the products you are looking for have these functionalities? You know, the ones that you need. Then proceed to the demonstration phase, which you need to do before you sign a contract. I can't stress this enough. You don't want to buy something that you've never seen. Then, utilizing your team throughout the selection process, you want to incorporate their input, suggestions, and ideas to narrow your choices and determine what needs to be included in your EHR vendor contract. Then after you sign the contract, there's going to be a discovery call where you and the vendor will, you're going to assign a project manager. This person will walk the practice through the training, implementation, and prepare the practice for the last step. Go live. So at this point, people are thinking, okay, I understand there's some things that I need to do before I begin my selection process, but they still don't know where to begin. They don't know where to start. So we want you to just feel free to start somewhere. And sometimes just having an idea of what your budget is going to help you narrow down your options to just a few products that fit your ideal functionality while also remaining in your target price range. So once you have an idea of what your budget is, you also really need to set a timeline. You want to have a good idea of how much time you want to take to do your research and demo your products. Pick a specific date by which you want to have a contract signed. It's kind of easier to work your way backwards with your timeline when you have certain ones put in place. And it's so easy to stay in the research demo stage and never move forward without a date for when you want to have a contract signed. A deadline definitely helps you move forward. Then you want to decide, when do you want to go live with the product? There are many questions to ask and consider when creating your timeline. Can the vendor accommodate your timeline for demos, training, implementation, and go live deadlines? Remember, when creating your timeline, your staff need enough time to learn the product before being expected to fully utilize the EHR while seeing patients and completing the daily tasks. So your timeline needs to go beyond go live. You need to define what go live means and looks like. Will you implement your EHR all at once? Or will you start with the practice management side first? Will you go completely cold turkey and stop using paper charts right away? Or will you phase them out over a period of time? In the end, you want to set a date by which you want to be completely paperless. Now begins your research phase. You want to begin your search by looking at what is your hospital using and what products are they offering to their physicians. What is your PO using? Are they offering any deals for their providers? Professional associations like the American Medical Association are recommending products. What products are the physicians in your area using? This is a good place to start, just asking around and finding out what other people are using. Often there are many strategic benefits that can be taken advantage of for providers that belong to a hospital or provider organization or even a large billing company. Price breaks are the most evident of the benefits. The larger organizations will purchase an electronic system in bulk and then they offer it to their providers at deeply discounted rates. Many of them also cover the cost of interfaces with laboratory facilities, which is really great. An additional advantage included in choosing a hospital bundled package is that they may provide IT support for the product. And everybody needs that. Everybody needs as much support as they can get. And this means that the provider will have local assistance for any IT issues that they may have with the system, even if the vendor themselves aren't local. An advantage to your provider organization and combining your efforts with them with a product is that they oftentimes have direct access to your reporting module, and they can pull patient data required from your office for other incentive programs like PGIP, Patient Center Medical Home, or PQRS, formerly known as PQRI. Now, there are two different types of approaches that a practice can use to meet the certification requirements for the meaningful use requirements. One is a complete EHR. This is your all-in-one product. It includes electronic records, e-prescribing, and with most, a practice management system which incorporates the scheduling and billing components. This system contains all the components and functionalities needed to be what's considered a 100% certified product. A few examples of a complete EHR would be Allscripts MyWay, eClinicalWorks, Epic, or Greenway. The second type of arrangement is called the modular approach. This is when a particular product is certified for meaningful use, but only when used in conjunction with another certified product. Separately, they do not make a 100% certified product, but together they do. An example of the modular approach would be a certified disease registry with a certified e-prescribing product like Wellcentive and Dr. First. To know whether a product you're looking at is certified for meaningful use, you want to visit the Office of the National Coordinator, or ONC, Certified Health IT Product List website. This is what we have listed here. If you have any questions on how to navigate through this website, your Regional Extension Center coordinator can help you. Now, there's another certification that is advised by many vendors. they advertise this and say, oh, we're the certification for commission for healthcare information technology is what we have. We're certified for meaningful use, but it's not the same. This is an important certification, but for those providers that are interested in the CMS EHR Incentive Program and meaningful use, the CCHIT certification does not mean that the product is certified for meaningful use. So it's very important when you're doing your research that you look for your product on the actual ONC website and not just see where that, on the vendor website that it says, meaningful use certified. You need to look for sure and know the difference between these two certifications. So as we said before, you want to make sure that functionalities is a key focus during the researching of your products. Many practices call up an EHR vendor and just set up a demo, yet they have no idea what to expect, what to look for, or what to ask about. So prior to having a vendor come out to your office or before you go out and see an EHR demo, you need to do your homework. Your office team should first identify the important features and functionalities that are necessary for your practice to have. We like to remind you of the 80-20 rule. No one product will be able to meet 100% of your needs 100% of the time. Instead, look for the product that will meet your needs 80% of the time. So don't get distracted by the bells and the whistles, because they may be great features, but the most important thing is it a functionality that is a key necessity for your office? Are those bells and whistles going to help you meet 80% of your needs? If so, then obviously that's important. But it's key to know when to disregard the extras and let that be, okay, less important. That's only 20% of what we need. We really need to focus on what's going to meet our needs 80% of the time. There's actually a standard for EHR functionality, but if you go with just the standard, you're only getting the bare bone basics. Many vendors may refer to this as out of the box, yet most practices who purchase EHRs right out of the box with no additional added features often struggle to streamline their office workflow and daily functions. And on top of that, we like to remind everybody that the standards will be changing because we're just beginning to understand what the industry standard will be. Also, your office may require something different from what is offered in just the standard product. Don't make the mistake of going for what you think is the standard. Go for what meets the needs of your practice. For example, while a primary care practice may have the same EHR as a neurologist and utilize the standard functions, they will both require additional and very different functions based on their patient population and practice priorities. These are the key areas to focus on when looking at functionality. We will go through each one individually so that you understand what these functions are and how they will be essential on a day-to-day basis for your practice. As we describe each functionality, please take note of those functions that are important to you and those that you would like to have for your office. Health information and data include the following: problem list, medication list, health maintenance, just to name a few. For many of you that are familiar with the meaningful use objectives, you can see that many of the required fields here are parallel to that of meaningful use. When it comes to how a system requires or allows data to be entered, EHR systems can vary. From a meaningful use perspective, a system that documents via free text will hinder the integrity and impede the ability of a practice to pull reports. Structured data fields for documenting are really a requirement for obtaining accurate reports. Results management basically allows the provider to document when they have ordered patient tests or consultations and then track the results or see that they have been completed within the EHR. The results management functionality can be considered your modern day advanced tickler file. It will be important that your system not only be able to create an order for lab tests or procedures, but then also receive the results back electronically, which will enable the tracking to be done within the system. You want to be able to eliminate as many paper-based tracking systems and processes as possible with the implementation of your EHR. I mean, ultimately, that really is the goal. You want to streamline things and eliminate manual processes. Now, some EHRs allow these kinds of electronic interfaces more easily than others, so it'll be really critical that you ask questions about these functionalities during demos. CPOE means Computer Provider Order Entry, and it's a function that providers may be familiar with if they spend time working in a hospital and have been used within this setting for a while. It's now becoming a standard within the ambulatory practice setting as well due to meaningful use and the increased use of electronic charting. CPOE is a required measure for meaningful use, and all ONC Meaningful Use Certified Complete EHR products will have this functionality. Clinical decision support is designed to assist physicians and their staff with decision-making tasks. Many providers are familiar with clinical decision support within the e-prescribing program when allergy alerts pop up. Clinical decision support takes this step basically a little bit further by adding things like reminders, prompts, alerts to aid providers with patient health maintenance guidelines. Clinical decision support rules will make sure that the physician is providing the right information to the right person in the most appropriate format through the right channels at the best time in the patient's care. Electronic communication allows providers to improve quality of care to patients, ease care transitions within the healthcare community, and provide improved support to the patient. Interfaces are is basically a structured transmission of data between two forms of health IT. A bi-directional interface is where two products can send information back and forth. A unidirectional interface is more common and is when one product can push information to the other, but not vice versa. Some examples of bidirectional interfaces are an EHR or registry with a lab like Quest or LabCorp or a local hospital. A common unidirectional interface is between an EHR and a registry, where the EHR will automatically populate data fields within the registry, or perhaps the registry will populate data fields in the EHR, but it can't go back and forth. Benefits of the interfaces are obvious. They eliminate the need for double documentation and automatically populate discrete data fields. You no longer have to scan your lab results or your patient reports. In some circumstances, if you have an interface with a hospital system, you'll automatically have access to the patient records, which is incredibly convenient. So interfaces, while they have fees involved often, they are well worth it. Patient portals are an excellent way for patients to take a more active role in their own health care. Patient portals are set up to provide a secure way for patients to view and access healthcare information. It's at the provider's discretion to decide what information will be pushed out to the portal. So a lot of times what we hear is that, practices are concerned about how that's going to, function. They don't want patients to be able to see their entire chart. It doesn't work that way. The practice will determine what actually gets sent to the portal. For example, you can send test results or medical history, current medications, an allergy list. It may be instructions that you've given a patient, and you want to make sure they have that and they can refer back to it. They could log into their patient portal and you could have those there for them. Or perhaps past appointments, or see that they are overdue for an appointment, or they have a scheduled appointment coming up. You could have that information in there. The EHR system's administrative functionality should be complementary to your own routine administrative tasks so that it can be used as a tool to better assist your administrative staff with their routine tasks. Managing multiple schedules, for example, for a practice that has more than one provider. Incoming patient records, billing, identifying patients for reminders or recall, and creating reports are truly an essential administrative functionality that the EHR you purchase should have. And while we kind of make fun a little bit with this cartoon, it's actually, kind of a key thing that you would want to have a functionality in your EHR system. You want to check, you know, somebody's insurance eligibility. That's actually something that some systems can do automatically, and the night prior to a patient's appointment. It's not a standard function on all EHRs. So if it's a key administrative function you want, you're going to want to make sure that the product that you're interested in has it. Being able to run reports within your EHR system is a huge advantage to your practice. It allows you to track your patients by chronic disease and use evidence-based practices to aid you in improving patient care. All ONC certified for meaningful use EHRs have reporting capabilities. The reports that you'll be running will not only provide you with the numbers needed for meaningful use, but also help you create a list of patients who need to be kept up to date with health maintenance tests and or exams, as well as be able to identify patients perhaps on a specific medication where there's a drug recall. That can be a huge time saver. The picture that we have shown here is an example of a meaningful use dashboard. There are several systems on the market that provide this kind of snapshot view of how you're doing with your meaningful use objectives. Dashboards, they can help you see what measures your practice are excelling at, those that maybe need to be addressed, and can often indicate a breakdown or an inefficiency in your workflow process. If you want to do more than just run a report on each measure, it's going to be critical that you ask the vendor that you're working with if the product has a dashboard feature showing you everything all in one place. Selecting the correct health information technology with all the functionalities and features that you want for your office will require due diligence on the part of you and your selection team. This is an important step that definitely should not be skipped. So what is it? Due diligence is all about researching the product. Generally speaking, due diligence refers to the care a person should take before entering into an agreement or a transaction with another party. Due diligence generally begins with your research about several different products. This allows you to evaluate EHR vendors and determine many of the functionalities your practice requires. Some important points that you need to find out in this process is, for example, what is the vendor's history? Have they had many mergers with other vendors? Has there been any buyouts? And if so, were prior customers and contracts and products honored and supported by the new company? Or were they completely dismissed and no longer supported, leaving the practice to have to purchase something new? You want to know, what is their implementation strategy? Is training web-based? Is the training method appropriate for your office, or do they need a hands-on training atmosphere? Do you have to travel to the training site where they're going to train you, or will the vendor come to you? Is the training they offer included in the price of the system, or do you have to pay for the trainers and their travel and lodging? When it comes to the vendor's implementation strategy, you'll want to find out, will you be able to pick any date you want to implement the EHR, or are you going to have to wait to implement your product when it's convenient for the vendor? If you're given a date by the vendor, does it coincide with your timeline? For example, if you are a pediatrician and the only go-live date the vendor is offering you is in September when you're busy with back-to-school physicals, that's probably not going to be a good product for you to go with, and because that's too difficult. Timing is definitely important. Another important component of due diligence is verifying customer satisfaction for the vendors you're looking at. When you talk to your colleagues and other people that you know, when they tell you about a product, you want to know, what are they saying about it? What do they think about the support and the company itself? Maybe the product looks great to you, but then you find out from someone else that they have endless technical difficulties and they can never get a hold of someone in customer support to resolve the issue. That would be something you would want to know before signing the contract. So it's a key component of doing your due diligence. So if you've come this far into your selection process and you haven't set a timeline, it's imperative to do so right away. You want to establish when you want to have your EHR purchased by, when you want to have it implemented, compared to what the vendor is promising you with your timeline. If they're promising you that something's going to be in place, or they don't, some aspect of the program isn't yet functional, but it will be. You want to be sure and keep checking in. Is that going to be ready for when you want to go live? And does it fit with the goals of what you and your practice are hoping to accomplish? During the demo process, you want to make sure that you are utilizing your team. Everyone in the office will be utilizing the product, so getting input from your MA and front desk is going to be very helpful. If you can't have the entire staff doing there for the demo of the product, you want to have one MA, a desk person, an office manager, and a physician present at the demo if possible. And sometimes we do realize that this is your whole office. So you will have to sometimes be judicious in how many people you're going to involve and who's going to be in your team. Having your office processes mapped out will also be helpful during your demo process, because it's going to allow you to ask the vendor to demonstrate how the product fits your office specifications. Your process map can help you to address challenges or unusual scenarios that are common in your practice, as well as making you aware of areas of your workflow that might actually have to be changed if you were to go with that product. So take notes on what's being promised to you during the demo process so that you're able to refer back to that and can be sure that you get it in writing during your contract negotiations. As we mentioned in the beginning, we have provided you with tools that will help you narrow down your electronic health record choices by helping you to ask questions you may not have thought of, as well as document and organize vendor information in a way that will help you to compare products side by side. Be sure to utilize these. Some of the tools to look for are your vendor analysis, key questions to ask EHR vendors, reference site visit questions and tips, and contract negotiation checklist. All of these are going to be very, very helpful to you. Another entity for you to be aware of is what's known as a VAR. To understand them a little better, we like to use the analogy of car dealerships and manufacturers. The EHR is made by the vendor, like the car is made by the manufacturer. A VAR is like a dealership. You can buy a car directly from the manufacturer, or you could buy from a dealership where you might potentially get incentives or additional services. The same can be true of a VAR. It's important to know when you're talking to somebody who's selling an electronic health record, whether you're dealing with the EHR vendor directly or you're actually talking to somebody who is a reseller, a VAR. When you're doing your due diligence with a VAR, find out if they're offering more than what the vendor would offer. Perhaps they can meet your timeline for implementation better than the vendor, or maybe they can offer better or local customer support. Just as with any other large purchase, you want to get all the numbers and information and compare. Your vendor should be able to provide references for practices who are using the EHR system. The references they provide to you should be for practices who have sufficient experience to speak knowledgeably regarding the issues such as the implementation process, the product's functionality, vendor support, documentation, and training. Your Regional Extension Center coordinator will also be able to provide you with practice contact information and get you in touch with practices that you can visit. It's essential to view the product in action and see how many clicks does it take to complete the routine daily activities. You should plan on visiting a practice that's similar to your own. If you're a one-doc internal medicine practice, it wouldn't make much sense to go visit a practice with 5 doctors that does pediatrics. During your visit, you want to be sure to observe the essential functionality of the system. This can be very, very different in reality compared to in the demo. In the demo, they're going to sail through very quickly and show you the perfect patient and how it goes very quickly, but they're not going to show you what it looks like in real time. When you get to the end of your visit with the patient and you're about to sign and close out the note, and all of a sudden the patient says, oh, oh, I forgot one more thing. You want to see what that looks like in action. How does the provider go back and document and correct things? So it's very, very critical to see how, another practice and how they're using it. And when you go, you will also want to make sure that you ask things like, what does the staff like most? What frustrates them the most? If they had to do their product selection or implementation again, what would they do differently? Would they choose a different product given the chance? And if so, what would they choose if they know of anything else? What were the unexpected surprises during and after their implementation? Did the vendor support the practice through the implementation process and afterwards? Is the vendor difficult to get a hold of when there are problems? We have provided tools to guide you through a site visit, so be sure that you take these with you when you go and add any additional questions to that list, because we often forget the questions that we don't have written down. We get into the visit and we see everything that's happening, and sometimes we just forget what our questions were. So if you visit or speak with more than one site, it's really important to ask each similar question so that you can compare the answers and make sure that you've asked the same thing. And you want to find out, are there trends with the product? Are you seeing something among the different practices? Did different sites have different experiences? And if they did, why might that have happened? Was it that one practice was more prepared for implementation than another? Maybe perhaps it was the comfort level with the technology, among staff members and the different practices. So by the end of a site visit, you really should have a good idea of what the pluses and minuses are for the EHR system that you're looking at. After you have done your due diligence, you may find that you have some more unanswered questions. It's important that you contact the vendor and get the answers that you need. Some of the additional questions that you may have forgotten to ask would be, will the vendor provide you with a library of templates, or will you have to create all of your own templates? If they promised that an interface would be available by the time you sign the contract, you're going to want to follow up and ask what the progress is on that interface. Is it ready now, or are they still saying that it's, quote, almost ready? Did they provide you a quote? If not, this is a really good time to ask for one. Now that you've done your due diligence and you've gathered all this information, it's time to narrow down your choices and prepare to make a decision. After taking the time to demo the products and conduct your site visits, you want to narrow down your vendor choices to your top two. You want to take the time to compare them thoroughly with your demo results and the information that you gathered during your site visits, and look at them side by side and analyze which is going to best fit your practice and your budget. You want to see what are the pros and cons, and you want to think about that 80-20 rule. Does each of them meet 80% of what you need? Will it interface with the labs that you use the most? And can you efficiently navigate the system to meet your patient needs? How many hours of training do these vendors offer? How expensive is it to get more training if it's needed, or if you have changes in your staff? Does the vendor include post-implementation training and support? This is really key, because when you first go through training, you don't really catch every little detail. You are going to need to have more training a little bit down the road for the nuances that you may have missed or forgotten. And you want to know, what will the support be like for those kinds of questions? You want to look for the differences in the proposals that the vendors have given you. Is one offering you more than the other? I can't state this enough. It is absolutely not rude to negotiate or expect the vendor to give you what you want. This is business. You'll be making a large financial investment in their company, and you deserve to get what you want and need. You're paying for it. You may not get what you ask for, but if you never ask, it's certain that you're not going to get it. You want to determine ahead of time, what are your deal breakers. Utilize your process maps to help you identify what functionalities and features are absolutely not negotiable. We can't state this enough. Get everything that is agreed upon in writing. If it takes 10 drafts to get it right, make sure it's in there. If it's not in the contract, there is no way to ensure later down the road that the company will deliver what's promised now to you without charging you extra. So don't let yourself be bullied into backing down. Within reason, of course. You'll probably never get everything you want for free, but if you do, I have to say, you are a master and you should be teaching a course for others. The vendor will try to get you to accept what they offer without negotiating, and they'll try to deter you with statements like, "We never discount this much," or "You have the best deal in the country. I've never seen this company discount this so much. This deal is only good until Monday." All of that being said, some incentives are actually time-related. For example, one EHR vendor recently had a government grant. If you were currently using their e-prescribing component, you were eligible to get their full EHR system at a substantial discount. However, this was only good until the end of the year. That was not a pressure pitch. That was actually a legitimate time frame. So if somebody tells you that the deal is only good for a certain period of time, you want to get a little bit more history into that. Are they just saying that, or is there something behind it? And one last thought on negotiations. You want to remember that this is a long-term relationship that you are entering into, and it doesn't end once the contract is signed. So it should have wins for both the customer and the vendor. So wait, before you sign any contract, we want you to review it very carefully. Are there any hidden fees that you were not aware of and they didn't explain to you previously? What about billing fees, or perhaps a clearinghouse fee? Are there extra fees for e-prescribing, maybe for formulary checks or for mail orders? Were there hardware fees for things like a new server or new computers and printers or scanners? Maybe perhaps they're very specific and you can't just buy any scanner or printer. You have to buy one off of one of their approved lists. These are things that you want to look for. What about are there any software upgrade fees for things like Microsoft or any other, software things that you're going to have to add on, maybe Excel, or maybe you have to purchase Crystal Reports. This is a product that helps you to run reports out of the system. Some systems require that. You want to know what other products will you have to purchase to be able to utilize the system. What are the maintenance fees for things like interfaces or health IT systems? Is that listed? Was it explained to you? And if it was explained to you but it's not in there, you want to make sure. Are there hardware requirements, as I mentioned, where you have to have something specific? How often will you be expected to replace your hardware in order to be compatible with their system as the upgrades are implemented? If they're going to require you to replace this every year as they upgrade their system, that's going to be something that could be a huge deterrent for you. You want what you have purchased recently to last you a while. And you want to be aware at this point. It's very easy to let the price tag to be the only deciding factor because it all becomes so overwhelming and you just see cha-ching, 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 the dollar signs are just adding up like crazy. Obviously you're going to refer to your budget, but you also want to make sure that it's not that only deciding factor, because if you choose the least expensive product but it doesn't have the functionality you need, you haven't saved any money. Rather, you've actually cost yourself more in lost productivity minimally, and you may have to purchase additional pieces, but at worst you could end up having to scrap the entire system and buy something new. So take the time and compare all the details. And remember, a proposed contract is not always accurate. So you're reviewing it for the details that pertain to your office specifically. You want to make sure that, there's the number of interfaces that you need are in there. Because that's in standard contracts, they don't know how many you're going to need. You need to look at that and discuss that with them and make sure that the contract has those details spelled out. Also, you want to be sure that anything that they have promised you during any demo times or any other discussions are actually in there. And you want to read through the proposed contract with a very careful eye. Are there penalties listed? This is very important because many times what you'll see is that there are penalties for you, the customer, but there's no penalties for the vendor if they don't meet their contractual obligations. Like, for example, if they committed to, going live with the product at a specific date and they don't meet that and they have to bump it. What happens? Is there a penalty for them? You want to have that negotiated into the contract. Some good things to ask for is, if they don't meet their deliverables, will they give you extra training hours or perhaps pay for an interface? These, should be added into the actual written contract. And they may fight you on this, but it's very important because you shouldn't be held to penalties if they're not. And once you have reviewed the contract carefully and all the changes have been made, take it to an attorney to have them review it. Your regional extension center can help make sure that your clinical interests are met, but in the end, we are not legal advisors. Once you've gotten through the negotiation process and your contract is signed, it's time to contact the vendor representative or project manager to go over the next steps. Before implementation process gets underway, the first thing that you're going to want to do is talk to that vendor contractor project manager to discuss the next steps and review your timeline for implementation and training. You may want to include your selection team for this conference call so that they can be a part of that planning. There are going to be many details you will need to review. For example, is your timeline still achievable or does it need to be adjusted now? When do you want to have interfaces with labs and registries in place by? Sometimes you want that, upfront done before you go live, and sometimes it's okay to wait and get used to the system and have those put in place later. But that's up to you, and you need to discuss that with the vendor. You want to make sure that every vendor that you're working with and involved with in this process knows and agrees to the timeline. It's very important that they agree to it and can deliver. You want to know what hardware needs to be in place first. What exactly will the vendor be doing prior to the go live? Clarify and get specifics of what will happen and when. Will there be vendor staff coming to your office for installation? What's the timeline for that? You want to break down exactly who is responsible for what and what will need to be done prior to training. When will the training occur? Who will need to be at each training session? You will need to decide, will you close the office for training? Will you have a small group of staff members join the training, or will it be the entire staff all at once? And of course, most importantly, you want to discuss what is going to be your go live date. Every practice should have a physician champion or super user. It's critical to decide who this is going to be. It should be done right after your contract is signed or during your discovery call with the vendor. The champion is a practice physician or member of the staff with enthusiasm and experience for using information technology for patient care. A super user is the person or persons who will learn the system quickly and help others. The champion or super user is going to share his or her electronic health record experience and lessons learned. They enthusiastically advocate for the information technologies and they assist their peers with learning how to use the EHR better and resolve issues. Now that we've taken you through the selection process, we want to review some areas or steps that often get skipped but definitely shouldn't, like due diligence. The selection process is often a very anxiety-inducing step for any practice. And so as a result, many times a practice will skip the pre-selection steps. And this is a mistake because you really do need to have a team. Office managers and physicians are unable to fully successfully implement an EHR product without the participation of their staff. It's way too much for a single person to accomplish. And as they say, no man is an island. No office practice can run without everybody playing their part. So the same is true for picking a product. You want everybody's input. The other thing that people often skip is mapping workflow. They say, I just don't have time for that. Your process maps are the keys to your success. It's like trying to move your office from one location to another without cleaning out the clutter first or without labeling your boxes. You'll have a much, much harder time transitioning. Without your process maps detailing the steps for each essential workflow, staff are going to come up with their own individual workflows. They're going to find shortcuts and workarounds, and they may or may not share that with other staff members, which means that no one is entering the same information in the same way, so you'll never get the results you're looking for with your reports, and you're going to have mass chaos. The last thing that people forget to do with pre-selection, or they don't forget, they purposefully skip it, is setting goals. It's very easy to get distracted with many other details, and you can end up picking a product that doesn't help you achieve the outcomes your practice would like. For example, if your practice has a goal of reducing patient wait time, finding a product that has an automatic insurance verification function will help you speed up your check-in process, and thereby put you much closer to achieving this goal. Would you buy a car without taking it for a test drive? Of course not. Purchasing an electronic health record is really no different. It's an investment and a tool that can ultimately improve your practice efficiency and optimize it to achieve higher quality of care for your patients, or it can bring your everyday activities to a screeching halt if you haven't chosen the right product. So don't miss out on that opportunity to talk and visit with another practice using the product that you're interested in. They can provide you with a first-hand look of what problems they have encountered and what they would have changed during their implementation process. Go beyond that test patient in a demo scenario and start looking at how your patient population is different than that test patient. You might have a large population who have congestive heart failure. How will the EHR work to help your patient population? Only seeing the product in a live environment can give you this kind of critical information. Another step many practices skip or avoid is setting a timeline. Sometimes people just aren't comfortable with deadlines, but if you and your vendor haven't created one, it's really needed, because you need to be able to prepare your practice. This is especially important for implementation. A timeline for your practice ensures that you do not lose sight of what your practice goals are, and you make sure that you continue to achieve them. The people who are responsible for providing the promised interfaces need to provide your practice with a timeline as well. It's really important to have a timeline of when your interfaces will be implemented. This helps you to have a much smoother transition. If you don't review your contract carefully, you might miss a crucial detail that can seriously affect the negotiated price. A good example would be making sure you understand how licensing of users is distributed and priced. You need to know how the licensing is established by your vendor. Each product is different when it comes to this aspect. Some charge a license fee only by provider and allowing a set number of staff members under that provider license. Others charge a license fee by workstation or computer, and some simply charge by the practice. So, we really encourage practices to review all of their contract details. Sometimes you get to this point and you're so fatigued from all of your due diligence and everything you're doing, you just want to be done. But we can't state enough how important it is to review that and have somebody, an attorney, review that as well to make sure that your legal interests are protected. Now that we've taken you through the selection process, you don't have to feel lost anymore. The vendor selection process involves several stages or steps. First, before looking at products, you need to develop a team to help you from the beginning to end. One person cannot successfully implement a product in an office. It takes a village. Develop process maps for your essential workflows and set 3 main practice SMART goals. Next, determine a budget. How much can you afford to spend in total and on a monthly, quarterly, or annual basis for maintenance, licenses, interfaces, and support? Set a timeline for your practice. Then put together a list of products you're most interested in and begin your research process. Do your due diligence before signing a contract. Don't be afraid to negotiate. Once you've decided and signed a contract, work with your vendor to review your timeline and all the details necessary to go live. Congratulations! You've taken the first step towards selecting the right EHR for your practice. If you have any questions or concerns, don't hesitate to contact your Regional Extension Center representative.